First, I want to thank you for inviting me. My name is Scott Dinehart. I'm a dermatologist and Mohs surgeon in Little Rock, Arkansas. As you know, I have a longstanding interest in cutaneous squamous cell carcinoma. We're going to talk about a recent article that concerns margins. And you know, cutaneous squamous cell carcinoma is a tumor on the move. It kills more people than melanoma in the United States. Also, we used to see 4 basals for every 1 squamous. Now we see equal numbers. So again, a tumor on the move. These are important articles, and we're seeing more and more of them. This article particularly wanted to answer the question: do we get any benefit by using adjuvant radiation therapy or postoperative radiation therapy to patients who have a close or involved margin on a squamous cell carcinoma at the scalp? So that's the question they wanted to answer. And it seems intuitive that it would be, yes, that sounds like a reasonable thing to do. And we do that all the time. But it turned out they looked at 114 patients. The authors were from Australia. There's a lot of patients with advanced skin cancer there. And these were mostly older men, as we would expect. But in their referral population, they had half the patients did not have a clear margin. The other half had clear margins. And so that's quite a lot. Usually in most studies, we see 10% or 15%. Then what they did is they took 28 of those 114 patients and they did additional surgery and radiation therapy. And then they did a multivariate analysis trying to control for all of the aggressive features of squamous cell carcinoma to see if using post-op radiation was helpful. And it turns out that, I think to their surprise and to my surprise, they did not get a positive result. This is a negative result, that radiation therapy really did not help improve outcomes. And again, they didn't really split surgery from radiation because they feel if both didn't work, that one of each wouldn't work. They also found that whether you had clear margins really didn't make a difference in treatment outcome, or at least if you had close margins, which is also a big surprise. Now, this was a retrospective study. There are some problems with it. You don't know how they selected patients for surgery. But I think what's really the big important point that I would make is that there is an elephant in the room, and that's immunotherapy. Since this paper had their patients, we have Pembro, we have cemiplimab, both approved PD-1 inhibitors for squamous cell carcinoma. And I'm using them more often in adjuvant therapy. And I'm getting great results anecdotally, but these are the kind of studies we need. You know, should we be using radiation therapy as adjuvant? Should we be using immunotherapy instead? Those are the questions that need to be answered and things that we think about. I'll end by saying that squamous cell carcinoma, I think it's long been underestimated. It's been undertreated. It's something that we've understudied. And it's nice to see studies like this, and I hope you enjoy reading it. Thank you.